Medical necessity criteria decide whether addiction treatment gets paid, and missing a required prior authorization is almost always an automatic denial, no matter how appropriate the care. Failing to obtain a required prior authorization is almost always a cause for denial, even when the treatment itself was clearly appropriate. Medical necessity is the golden key that unlocks insurance coverage for addiction treatment. Here is the overview every biller and operator needs. We cover what medical necessity means, the ASAM standard insurers use, how prior authorization applies it, and the codes that trigger it. A service is medically necessary when the insurer agrees it is reasonable, appropriate, and essential for the patient's health. It must align with generally accepted standards of care and be clinically appropriate for the patient's condition and severity. It cannot be mainly for the convenience of the patient or provider, and there can be no cheaper, equally effective alternative. Failing to meet an insurer's specific medical necessity benchmarks is one of the most common reasons addiction treatment claims get denied. When documentation does not match the criteria, coverage is denied as not medically necessary, and that is one of the most common denial reasons in SUD billing. The Mental Health Parity and Addiction Equity Act bars stricter limits on SUD care and requires insurers to disclose their medical necessity criteria on request. Behave Health's platform is designed to help you capture the intake assessment, diagnosis, and treatment plan in the language of the criteria payers review. It is designed to support capturing the clinical assessment, diagnosis, and treatment plan insurers ask for during a prior authorization review. It is designed to support the verification of benefits and prior authorization workflow operators run before admission, so required approvals are secured upfront. 4 things decide whether an addiction treatment claim is approved as medically necessary. Let us walk through all 4. Get the criteria, the ASAM standard, the prior authorization, and the codes right. Miss one and the claim is exposed. First, know which criteria your patient's insurer actually uses to judge medical necessity. Insurers apply detailed criteria like ASAM, MCG, or Interqual, proprietary utilization review tools that act as the checklist for coverage. Aligning your documentation and treatment plan to that specific criteria set greatly increases the chance of authorization and payment. Second, support the level of care using the ASAM criteria, the most widely accepted standard for addiction treatment. ASAM evaluates patients across 6 dimensions: withdrawal risk, biomedical, emotional and behavioral, readiness to change, relapse risk, and recovery environment. Many state laws now mandate that insurers use ASAM placement criteria for SUD decisions, and most major payers have adopted it. Third, obtain prior authorization before delivering higher levels of care. Prior authorization is commonly required for inpatient detox, residential rehabilitation, partial hospitalization, and intensive outpatient programs. United Healthcare advises allowing about 5 business days before starting services to get the review done and receive the decision letter. Fourth, submit clinical documentation and use the exact language of the criteria. Payers ask for an assessment or intake notes, diagnosis, treatment plan, and sometimes an ASAM placement worksheet during the review. If relapse potential is high under ASAM Dimension 5, spell it out with specifics. When you speak the insurer's language, you make it easier to say yes. Certain billing codes instantly raise the medical necessity and prior authorization question. The code must match the level of care authorized. H0010 through H0014 cover detoxification, from subacute and acute residential detox to ambulatory withdrawal management. H0015 is the intensive outpatient program code, billed per day. Many insurers require prior auth because it is a bundled intensive service. H0017, H0018, and H0019 are the residential treatment per diem codes, short-term, medium-term, and long-term, and these are HCPSS Level 2 codes. Behave Health connects the verification, documentation, and coding steps so the elements that prove medical necessity are captured as the work happens. It is designed to support running the verification of benefits and securing any required prior authorization before admission. It is designed to support capturing the assessment, diagnosis, and treatment plan in the language the criteria review expects. It is designed to help you build a correct level of care code so the claim matches the service the insurer authorized. Stop losing claims to medical necessity denials. Book a 20-minute demo of the verification, documentation, and coding workflow at behavehealth.com. See the VOB, prior auth, and ASAM aligned documentation workflow built for addiction treatment billing at behavehealth.com.